Yes.
I'm closing the door for privacy. Hi, good afternoon. My name is Yaoska. Nice to meet you.
To meet you.
I'm going to be your nurse today. Okay.
Okay.
And I'm going to be conducting your head to toe assessment. Is that fine with you?
Yeah.
Okay. So let me wash my hands. Can you verify your name and date of birth for me?
Carlos Garcia, 5773.
Okay, perfect. Mr. Garcia, do you have any allergies I should be aware of before we begin?
No.
No? Okay, so I'm gonna wash my hands again and put on some new gloves. And I'm gonna go ahead and bring up the bed. Mr. Garcia, before we begin, I have a couple of questions for you, okay?
Sure.
So what brings you in today?
I have strong headaches
Okay, you have a strong headache, and how long have you had this headache for?
for 2 days.
For 2 days, okay. And have you done anything to alleviate the pain? Have you taken any
Yeah,
medication?
I have to take a leave.
A leave, okay. And how would you describe the pain?
Really strong, sharp, and like they stabbing me on the side of my head.
Okay. And do you know when did the pain start? Like, I know it was 2 days ago, but were you doing anything? Did you hit your head?
It was just in the morning when I woke up.
In the morning when you woke up, okay. And does the pain radiate anywhere else in your body? No? So it stays like right here on the sides? Okay. And from a scale of 0 to 10, 10 being the worst pain possible and 0 being nothing at all, how would you rate your pain?
7.
A 7? Okay, that's a little high, so I'll let the doctor know about that in my notes, okay? To see what we can do for you. Okay, do you know where you are today?
Yeah, Garcia Hospital.
Okay, and do you know what day it is?
June 21st to 2020.
Okay, and do you know who our president is?
Donald Trump.
Okay, so patient is in all times 4. There's no slurred speech. He's able to articulate. I'm tracking his overall mood, and his personal hygiene is nice and well kept. Seems to be in a good mood. And okay. So do you wear any hearing aids?
No.
Do you wear any glasses?
No.
No? Okay. So I'm gonna go ahead now and start with your scalp. Is that okay with you?
Yes.
Okay, so I'm gonna bring down the bed round. Okay, so I'm gonna go ahead and check your scalp. I'm gonna check for any alopecia. I'm gonna check your hair distribution, for any scarring, any bruising. Okay. And I'm gonna check the symmetry of your head. It seems nice and round. Okay, good. So I'm gonna go ahead and check your ears. Okay, is that fine with you?
Okay.
I'm gonna check his ears. Okay. For any drainage or any redness. Good. Okay, Mr. Garcia. Can you go ahead and smile for me? Okay, I don't see any facial drooping. Okay, his face is nice and warm to the touch. And let me check your eyes. Okay, so I don't see any jaundice, any cyanosis in the eyes. So let me go ahead and measure your eyes. For 4. You said you don't wear any contacts or glasses, correct? Do you have any blurred vision, any double vision?
No.
No? Any trouble seeing or anything like that? No? Okay, so I'm gonna need you to follow my pen. Okay? Okay, so now we're gonna go to the side. Okay. Perfect. I'm gonna shine the light over your eye, okay? Just look straight for me. Okay, so pupils are equal, round, and reactive to light. They're a size 4 millimeter, which is good. Now we're gonna go ahead and check your nose. Is that fine with you? Okay. So I'm gonna check for any polyps, any deviated septum, any drainage in the nose. Seems to be symmetrical. Good. I'm gonna go ahead and grab something. Can you smell this for me?
Alcohol.
Alcohol. Perfect. Good. So I'm gonna go ahead and check your mouth now. Do you wear any dentures? No? Okay. Can you open your mouth for me, please? Okay, so I'm gonna check the gums. Can you stick out your tongue? Okay, so it's nice and pink. I'm gonna check to make sure there's no bleeding of the gums or anything like that. Okay, can you close your mouth? Okay, his overall, his lips are nice pink and moist. And so now we're gonna check. Can you swallow for me? Okay, good. He's able to swallow. I don't feel any deviated trachea. Can you turn your head to the left for me? I don't see any signs of JVD. Turn to the right. Okay. And so now, Mr. Garcia, I'm gonna go ahead and check the trunk of your body. Okay. So we're gonna start with your arms. Okay. So, can you go ahead and sit for me? Okay. So I'm gonna look at the overall symmetry of your hands. Okay, which is good. I'm gonna check the temperature, nice and warm. I'm gonna check for any IV, any bruising, any scarring. Okay. I'm gonna check your cap refills. Okay, good. It's less than 3 seconds. Your nail beds are nice and pink. Okay, good. And do you have any pain or anything on your arms? No? Okay, so I'm gonna go ahead, check your radial pulse, radial. Okay, so rod, good. Okay, so we're gonna do a little bit of range of motions, okay? So pick up your arms for me, take them to the side, bring them down. Okay, bring them back up, bend them. Okay, shrug your shoulders, bring them back down. Okay, good. So, everything seems to be good. Now, Mr. Garcia, I'm gonna go ahead and check your lung sounds and your heart sound, okay? Is it okay if I go ahead and bring down your gown?
Yes.
Okay, so I'm gonna go ahead and expose his chest. I'm gonna look at the overall symmetry of his chest and also the temperature. Check for any scarring or any bruising. Mr. Garcia, do you have any lung issues, any heart issues I should be aware about? No?
No.
Do you smoke?
No.
No? Okay. Do you have any cough or any mucus? No? Okay, so we're gonna take 6 deep breaths, okay? We're gonna breathe in and out, okay? Breathe in. Breathe out. 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 Okay, good. Your next sounds are nice and clear. Now we're gonna check your heart sounds, okay? So we're gonna start at the aortic, the pulmonic, parasternal, tricuspid, and mitral. Good. Sounds good. So we're gonna go ahead and cover up your chest. And now I'm gonna check your back, okay?
Okay.
Is it okay with you if I expose it? Okay, so bring down the back. I'm gonna look at the overall skin integrity. I'm gonna check, make sure his spine is nice and aligned. And while also checking the temperature, I'm gonna check his coccyx for any skin breakdown, the bony prominence back there. Everything seems to be nice and equal. So I'm gonna go ahead and I'm gonna check your kidneys. Okay, so 1, 2, okay. And we're gonna do 8 deep breaths, okay? Just like before.
Okay.
Okay. So I need you to cross your arms for me. Okay. So breathe in. Breathe out. 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 Okay. Your legs sound good. We're gonna bring this back up. So now, Mr. Garcia, can you lay down for me? So, Mr. Garcia, I'm gonna go ahead and check your abdomen now, okay?
Okay.
When was your last bowel movement?
30 minutes ago.
Was it normal?
Yes.
Did you have any difficulty or anything like that? No? Okay. And are your bowel movements usually normal, or how would you describe them?
Normal.
Normal? Okay, good. So, do you have any scarring on your abdomen that I should be aware of? Any past surgeries or anything?
No.
No? Okay, so I'm going to go ahead and roll up your gown now to expose your abdomen. Is that okay? Okay, so I'm going to roll up this his gown. I'm gonna look at the overall skin integrity of his abdomen. I'm gonna look for any distension, any possible masses that could be poking out. I'm gonna also be looking for any bloatiness he may have. I don't see any. I'm gonna also check the temperature of the abdomen. Okay, nice and warm. So I'm gonna go ahead and osculate for his bowel sounds. Starting at the right lower quadrant. And then going in a clockwise manner. Okay. So I'm gonna percuss. I'm gonna look for any dull tympanic sounds and palpate. Okay, good. So I'm gonna bring this down, Mr. Garcia. I'm gonna check your perineal area. Is that okay with you? Okay, so I'm gonna pull this up. I'm gonna look for any catheter he may have in place. I'm gonna look for the overall cleanliness. See if there's any skin breakdown or anything like that. I'm gonna also, Mr. Garcia, do you have any problems urinating?
No.
No. Have you noticed a change in the color of your urine? Any change in the odor?
No.
No. Do you have like a stinging or tingling sensation as you urinate? Any difficulty urinating? No. Okay, perfect. So I'm gonna roll this down now. Okay, so I'm gonna go to your legs now. Is that okay with you?
Yes.
If I expose your legs? Okay, perfect. So I'm gonna go ahead and roll up his legs. And I'm gonna inspect the overall symmetry of his legs. I'm gonna also check the temperature of his legs, make sure they're nice and warm to the touch and nice and dry. I'm gonna check the hair distribution on his legs. I'm gonna look for any redness, any swelling on the calves, or any edema. Okay, to see for any signs of DVT. Okay, I don't see any signs of DVT. So I'm gonna check his femoral pulses, his popliteal, dorsal pedal pulses, and post-tibial pulses. Okay, good. So Mr. Garcia, we're gonna do a couple of range of motions, okay? So can you separate your legs for me? Bring them in, okay? Can you bend your knees for me? Okay, bring them out, good. Now I'm gonna check the calf refill on your toes. Okay, perfect. Less than 3 seconds. And then check in between your toes to make sure that there's no skin breakdown between your toes. Okay, everything seems to be nice and good. Then check right here on your bony prominence to check if there's any skin breakdown. Okay. And do you have any difficulty walking or anything like that? No? Okay. So I'm gonna go ahead and push your feet. Okay, and you're gonna try and make sure don't let me push them, okay? Okay, overall strength is good. Can you point your toes for me? Okay, you can go point them back. Good. Can you put them in a circle? Go in a circle. Perfect. Okay, good. So now, Mr. Garcia, I'm gonna go ahead and lower the bed. Okay, and I'm going to need you to stand up for me, and I'm gonna check your balance. Okay?
Okay.
So I'm gonna go ahead, bring down the bed, bring down the railing. Okay. Let's help you stand up. Okay. Can you close your eyes for me? And have your arms out for me. And put your feet together for me. Okay. Okay, this balance seems good. Okay, you can open your eyes for me, Mr. Garcia. Okay, you can have a seat for me. Okay. So, Mr. Garcia, just the last couple of questions. Do you feel safe here?
Yes.
Do you feel safe at home?
Yes, I do.
Yes. And do you feel like hurting yourself or anybody else?
No.
No. Okay. And you said you didn't use any assistive walking devices, a cane or a walker or anything like that, correct? Okay. So I'm done with my assessment. Okay. I'm gonna give you the call light. Let me go ahead and fix you up in the bed. So let's lay you back down. Bless you.
Thank you.
Let's cover you up. Okay. And let's make sure all the readings are up. Okay. And I'm going to lower you to the lowest possible point. And I'm going to wash my hands. Okay. gonna take off my gloves and wash my hands. Okay. And if you need anything, let me know, okay?
Thank you.
And now close the door and document.